mynews.studio.
A twice-yearly HIV prevention shot has just received a recommendation from the World Health Organization. There's a lot of optimism around it, but the key question is, will it actually reach the people most at risk?
Today's date is July 21st, 2025. The WHO made this announcement at the International AIDS Society Conference in Kigali, Rwanda. For the first time, they're recommending a long-acting injectable, lenacapavir, for HIV prevention. Why is this such an important development?
It's significant because this is the first HIV prevention option the WHO has endorsed that doesn't require taking a pill every day. Lenacapavir is just 2 shots per year. That's a big departure from daily oral PrEP, or even cabotegravir, which needs to be injected every 2 months.
Right, and cabotegravir, often called Cab-LA, has already proven highly effective with its every 2-month schedule. With lenacapavir, the convenience factor goes up again. But in terms of effectiveness, how do these injectables compare to daily pills?
Clinical trials show that both cabotegravir and lenacapavir provide nearly complete protection when used as pre-exposure prophylaxis. For example, in the US, since cabotegravir was introduced, there have been no reported HIV infections among users. Only about 8% experienced side effects, and those were mostly mild.
And with lenacapavir, the twice-a-year schedule could really help people who find daily medication challenging. But what about sticking with the regimen? Adherence issues.
That's exactly the point. Daily pills can be forgotten or avoided due to stigma or lack of access. A shot every 6 months sidesteps many of those problems. Plus, the new WHO guidelines are making things easier. Rapid HIV tests and delivery through community programs mean people don't need to go to a clinic as often.
That could make a big difference, especially in rural places or where health resources are stretched. But the numbers are still stark. In 2024, there were 1.3 million new HIV infections. The groups most affected, sex workers, men who have sex with men, transgender people, people who inject drugs, still face the greatest risks.
Yes, and that's why WHO and partners are talking so much about equity. They want to train providers, bring these injectables into existing health services, and work with communities to make sure the highest risk groups have real access.
But what about actually getting these injections out there? Are there any major bottlenecks for low and middle income countries?
There are several. Regulatory approval is a big one. The FDA's decision helps, and WHO pre-qualification can speed things up, but each country still needs to approve the drug. Then there's manufacturing and funding. Long-acting injectables cost more than daily pills, so ongoing investment is essential.
And what about the logistics? Things like cold storage, staff training, making sure people come back for their next shot? Can health systems with limited resources handle that?
It's definitely a challenge. The WHO's recommendation includes operational guidance, like simplified testing and community-based delivery. But realistically, in many low- and middle-income countries, people may not see access until late 2025 or even early 2026.
Is there a risk that stigma or misinformation could slow things down?
Absolutely. Stigma is still a major barrier, especially for the groups we mentioned earlier, who've already faced discrimination. That's why the rollout strategy puts community engagement at the center.
And monitoring. How will governments and partners track whether this approach is working?
WH is urging everyone to collect real-world data on effectiveness and adherence as these injections are introduced. That information will help adjust programs and secure ongoing funding.
So this is not just about the science. There's a real chance to close persistent gaps in HIV prevention, but only if governments, funders, and communities move quickly and work together.
And it's about giving people more choices. That's always been key in public health. Now we'll see if these new options can shift the balance in the fight against HIV.
A twice-yearly HIV prevention shot. Simple, effective, and with the potential for real impact. But as always, access and equity will be the real test.
Thanks for listening. Today we covered the WHO's endorsement of long-acting injectable HIV prevention, the science behind lenacapavir and cabotegravir, the rollout hurdles, and what it could mean globally.
Thank you for joining us. This episode comes from mynews.studio. You can try it now for free.